Our department is charged with population health, and one of the leading causes of death in Jefferson County is overdoses, specifically opioid overdoses.
Our main duty is to follow up with community members who experience an overdose, so we get to have great conversations with people.
Our department first started distributing naloxone in the nasal form around 2018.
Super simple to use, but essentially it's a small nasal spray. You stick this part up their nose and you push this pink trigger and it's going to spray up into the mucous membrane. It's going to take about 2 to 3 minutes to take effect.
But really, when things exploded was when naloxone went over the counter. That provided us an opportunity. We had these red boxes. Those were funded by a grant we received from the state health department, and we deployed those out to nonprofit organizations where we thought there would be a high number of people at risk of witnessing an overdose, small businesses like corner stores, liquor stores, a couple of grocery stores, bars and restaurants, really to have a lot more of what we call passive distribution. The Surgeon General for the US said that every American should carry naloxone. We are in a crisis. We're losing hundreds of residents each year in Jefferson County, and naloxone is the best evidence-based way to reverse an overdose and save a person's life.
A lot of what we hear is people saying like, no, I don't use drugs, I don't use substances, so I don't need Narcan. And so instantly we have like an educational opportunity, you know, and it can be as simple as like, I don't use substances either, but I carry it. It could be something like, you can't Narcan yourself, somebody else needs to do it.
Since then, we've tried to just continue increasing access and expanding who is able to get naloxone while simultaneously educating the community on why it's not just people who are coming to our syringe exchange who should have naloxone available.
Even after they were falling in some areas, there were still other areas that saw an increase of overdoses, and they had an idea of putting naloxone boxes on all 21 Louisville Fire Department houses.
And when we spoke with the fire department, they immediately were supportive of that idea, didn't ask why they should do it, asked, you know, how do we move forward with this? This process just kind of went from idea to implementation faster than anything I've seen before.
A person that has that anxiety of like not wanting to go tell somebody they're struggling can come and get that Narcan box, or has a loved one that's struggling and can have that Narcan on them, and they're able to save their life, able to give them a second chance, able to go get into recovery. Because a person who overdoses and dies doesn't get that chance to have recovery. We're the first safe places for the YMCA for people to come to that were in trouble. So we've been doing this for years on years of like opening our doors or opening our facilities to the community. We want to make sure that we're not having those emergencies in our community. So this was just one of those initiatives that we were able to get into and back. And it really, it's at no cost to us, it's at no cost really to the city, and we're able to help our community.
Each one of the past 3 years, we've seen decreases in the number of people who are dying of overdose in our community, and it's undeniable that naloxone distribution is playing a part in that decrease. So we have over 40 public naloxboxes available to anybody, free of charge.
If you're in a part of Jefferson County and you're unsure of where the closest place you can go to get Narcan or naloxone, you can go to findnaloxoneNowKY.org, and it's a super simple, straightforward website. It has a map of Kentucky. You just zoom in on where you're located and the pin will show you where the closest location is.